Okay, when you lecture with Dr. O, you can come. Okay, when you lecture with Dr. O, what's the lining epithelium of the membrane? What's the lining of the membrane? Stratified. Okay. So, with your physiology, what is the direction? What is the direction of the cilia? The movement of cilia? Like, okay, based on your physiology, how does it work? Cilia is what? Microfilament? Microtubule? Microtubules. Okay, what's the correlation? If we are going to discuss the normal, that's why we should know what's the normal so that we can correlate with the diseases. Okay, what vice that will really damage the cilia? Smoking. So what's the mechanism of smoking with the cilia?
Matanggal ng cilia.
Accumulation of the mucus. The accumulation of the mucus has nothing to do with the cilia. Why? The accumulation of the mucus is what? What's the lining epithelium again? Stratified, ciliated, columnar. Among those that you mentioned, which one is responsible for the mucus secretion? Meaning it has nothing to do with the secretion. But if there's an irritant, what will happen? The blood cells will produce mucus. If there's bacteria, it will. And then it's the purpose of the cilia is in one direction pushing the inspectorated. Okay? So, back in your lining epithelium, what are the layers of a mucosa? What are the layers of a mucosa? Or what consists of a mucosa? What are the layers of the mucosa? Hey, if I will ask you, okay, during the moving exam, during the probe, it's almost always, I think the mechanism in probe is, you're just sitting, but the type of exam is same. Okay, at the pointer, what is the lining epithelium? Pseudostratified, ciliated, columnar, regular cells. What is the cell name? Respiratory epithelium. What is the layer? What's the answer? Siga, mata. Mucosa. Oh, what are the layers? Mucosa, submucosa. Next. What's the next? Submucosa. Okay, what are the structures that you can find in the mucosa? You're not kindergarten or high school we're really school feeding. That's why I really intended you have 1 hour to study so that ito magmana by the time that you will get in my class. This is your second course already. Okay? CIM really is siguro. I'm teaching also siguro they're doing alone. Like doing alone. We're just there just to look at we're learning game. Siguro we're yaya, sure. But here, of course, we have to discuss. So what are the layers? What consists of an epithelium? Based on your lecture. Based on your lecture. Do you really need an epithelium is lying? What is beneath? Then what else? lamina propria. Okay. Okay, we really have to mention, lamina, membrane, by the time of the second year, it's very useful that you really can identify the basement membrane. Why? If the basement membrane is intact, the term for the cancer is in situ, meaning carcinoma in situ. But if the basement membrane have been invaded already with the plasma, that's what we call is invasion, meaning it's very obvious that this is very malignant. The cells are really malignant, really invading, like invading ductal carcinoma of the breast. Okay? So again, why we have to identify? Because to determine or to differentiate between an in situ, a carcinoma in situ, and an invading carcinoma is the intact basement membrane. Then, if you don't know what is basement membrane, by the time you become second year, you don't really not tayo. Diba? So that's why you really have to know, this is the basement membrane. An epithelium, basement membrane, lamina propria. Next is connective tissue, which consists of the submucosa, okay, which has the glands. There are two organs. Very good. You have to always remember that there are only two organs with submucosal glands. One is the esophagus, and the other one is the duodenum, which we are not going to discuss yet today. Okay. Then why you really have to know this is the submucosa, because by the time you become second year, you have to do staging. What is staging? Okay. If intact, the cancer cells is above with an intact basement membrane, most probably that's stage 1. But in every organ, the staging will differ. Yeah. Si uterus, with this invasion lang, it's already stage 2. This now is already stage 3, but it's different from the colon. When you say colon, if it's in the muscularis, it's still stage 2. But it will really differ, but you really have to know what are the failures. Not just that, this one, this one, for the purpose, but as early as now, we're going to teach you that these are the purpose. Because during our time, it's very bad, our teachers are not also pathologists. So by the time we're no longer, first year, we don't know yet the purpose, why do we have to? So we have to know what is normal so that we can identify what is abnormal. Diba? In your anatomy, if you don't know that this is the normal lips, you don't know that if there's a cleft, that's an abnormality. But you can really not answer. So that's why we really have to polish first year subjects. What is this? What are these? What are these glands? Sebaceous? What's your sebaceous? Okay. What is this? Hyaline cartilage. Where can you find? What layer? If I'm going, I'll be the one to teach the exam. But most very easy again. Especially it's your first time. So identify the structure at the pointer. What's that, sir? Hyaline cartilage. What layer? Submucosa. Identify. What layer? Identify the organ. Okay. Identify the structure at the pointer. Basement membrane. Identify the layer. Okay. At the pointer, which one does not belong to this layer? Choices, multiple choice, don't worry. It's all multiple choice. It's only book you really have to write the wrong. I'm very lazy checking. I want the machine to check. Okay, so you can already identify. But I don't know why it's not working. Supposedly, I have a very good notes na very easy na yan today. How can you differentiate between intrapulmonary with terminal bronchial? Or how can you differentiate the respiratory with the terminal bronchial? 1, 2, 3, 1.
Walay
Uy, delete. Sige lang. Because it took also a long time. I've been teaching 16 years. It took me 15 years not to really, when you become a teacher, it's not very good. But when you become a teacher, you really have to find how to simplify things for the student. Possibly I have a very good table. It's not working. So anyway, laptop lang lang. Poor biya na to ni, malatag si mga doctors, di mga yung condition. You're very lucky. So again, si mga doctors, paninto na si mong bugan. Yan ang problem sa cable na kung other kani is compatible with the 7th floor. I don't know. Before naman ni siya. Pero ang kaya na yun, tumoy dili. Sabot lang mo, kita ba? So step 1, you really have to choose, you have to look for the lining epithelium. And there are few lining epithelium that you're only going to memorize. First is the respiratory. Ano, may touch to screen din. May laptop. Bagian yung kapur. Okay, whiteboard. So respiratory, no. Step 1 is really the respiratory. Then next is the simple cuboidal. So what belongs to the respiratory? The trachea, bronchi, and the larger bronchioles. But to the simple cuboidal ciliated, the smaller bronchioles, the terminal bronchioles, and the respiratory bronchioles. Step 2, you look for the cartilage. What's the shape of the cartilage? Okay. So, if I'm going to present them, like I'm only sige. So example, during look at that one now. So again, step 1, respirator, the epithelium. What are the epithelium that can be found in the lungs? The respiratory or pseudostratified ciliated columnar with goblet cells. Next is the simple cuboidal. That's the only two that you're going to memorize. Why? The alveoli, alveolar sac are simple squamous. Meaning it's very easy. But this one you really have to memorize that up to the larger bronchioles are the only one with respiratory. Okay. So I'm going to ask you, in a microscope, I will not show the other layers. I will only show this one. What is the organ? What is or are the organs? Choices. Trachea, larger bronchioles, smaller bronchiole, except Smaller, ha? Oh. Not necessarily, this one, automatic trachea is the answer. No, because the other organs that which has respiratory is the trachea, bronchi, and the respiratory bronchioles. Okay. But how can you differentiate? If I will tell you the organs that belongs with the organs with this kind of lining epithelium, how can you differentiate between the three? Cartilage. Meaning, you have to look for the cartilage. If I will not show you the entire trachea, never answer this is bronchi, this is larger. Why? To differentiate is really the differentiate the three is the shape. Meaning, if this is C-shape, automatically, if I will tell you what is the organ, it looks like C-shape, then this is trachea. And then, if it is irregular, automatic it's not C-shape, automatic your answer, it could be bronchi or larger bronchioles. Meaning, between the two, you can really not differentiate. But they have, you can only differentiate if this is the edge, where you can find the lining epithelium, but there's a transition. Oh, it's no longer with goblet cells and with goblet cells. Meaning this is already the cuboidal. Then what is your answer? Meaning that's smaller already, right? So, when I second step, third step is the presence of alveoli. Meaning, if there's the presence of alveoli, from the word alveoli, what's the use of the alveoli? Gas exchange. From the word gas exchange, from the nomenclature of this organ, which one has respiratory? Automatic, respiratory, meaning the terminal, if you see the terminal has no alveoli, meaning if it has no alveoli, that's terminal. If it has alveoli, respiratory. Yeah, we have pictures, if makarelate. It's so hard to teach nga wala. Another way of presentation. What is the first step? Lining epithelium. Respiratory against simple cuboidal. What belongs to the respiratory? Trachea, bronchi, and the larger bronchioles. How can you differentiate between the two? The presence of, not only the presence, but the shape. C-shape, trachea, the bronchi and larger, irregular. And then, if you try to look at, this is no longer the pseudo-stratified ciliated columnar pistil kataas. Respiratory in short. Simple cuboidal. So, if the simple cuboidal, your choices are the only smaller bronchioles, terminal bronchioles, and respiratory. How can you differentiate the three? The last one with cartilage is the smaller. From the word terminal, terminate. Goodbye cartilage, terminate goblet cells. Meaning, if you see that these are already cuboidal, what you have to look for next? Look for alveoli, di ba? Meaning, if there's the presence of alveoli, it's automatic, the respiratory, bronchiole. If purely yun nga, small, simple squamous, that's the alveoli, alveolar sac. Okay, but to differentiate with the others, from the word respiratory, kung sa'yo mo respire, mo gas exchange, presence of alveoli. Terminal, what to be terminated?
No cartilage,
No cartilage, no goblet cells. Okay, picture. Oh, babe. Look at the poor yun na to. I feel so poor today. Identify the organ, base it on the steps. First step. What's the lining epithelium? Pseudostratified colloquial. Why, by the way, what was being mentioned by Dr. Mark? Why is pseudostratified? From the word pseudo, false. What makes it false? What's the layer? What the layers name about? Yeah, there are columnar, there are cubical, there are squamous. Okay, so that's why it looks like stratification, but it's not. Structure pointer at the pointer. God bless us. Structure at the pointer. Step 1. What is the lining epithelium? Step 2. Can you identify? No. Di ba? Next question. What is this organ? What is this organ? Ikaw, smiling kayo. What is this organ? Back to step 1. So this is step 1. What are those with respiratory? Maybe if you are going to naranaban mo yung oral verbalida no? 30%. If I'm still applying, I will not study here. Okay. Kurang lisod yun. Not for everyone, ha? No matter the difference that you're a good speaker and you're very intelligent, different. Like, I only developed my speaking skills when I was already teaching. But during my one, I saw kurang text message akong listen sa mga putol-putol. So, if this is the lining epithelium, you cannot identify, but it could be a trachea, it could be a bronchi, it could be okay. We cannot proceed on to the next step, which is the presence of cartilage. Now, if this is C-shaped, if it has a C-shaped cartilage, then that's trachea. Sige daw. May hoy, accountant here, accountant, chucho, mga fishery. You're all paramedical? Oh, engineer, teacher, nun, father, priest. Wala? Ay, nanay siya tusok ko na ilaw. Ano? Kanang mura, may on. Yes, ba? Wala, no?
Gusto ba?
It's very problematic. During my time, I'm also a graduate here. Medicine. Pero okay, paggamit man maski dili medicine. Share. And the tuition fee is very expensive. Silang, anyway, mana ha. Uy, ano naman siya? Oh, that one. What is the organ now? Trachea. Good. Wait, this is very, if putol-putol, irregular, what are your choices? Bronchi or larger? Okay. What layer? Mucosa. What layer?
Tapos yung sa
Pointed as the structure. Hmm? Zeros. This one.
Ajay.
To differentiate between an invasive carcinoma and an carcinoma in situ, what structure? Basement membrane to differentiate. Very good. You're really learning. Okay. Based on the step, first step, look for what's the lining epithelium. Okay. So what are the possible organs? Based only on the epithelium. What are the possible organs? Trachea, bronchi, and the larger bronchioles. Next step, cartilage. What's the shape? C shape. So now, what is that? The organ. Very good. Kamao na gyud. Okay. When you practice, so supposedly mo tanin yung buhaton during the hours or next week, diba? You have free time next week. You borrow also the skin. Why? Sometimes it can be difficult to differentiate the skin. But para na ko, of course, 16 years. Yeah, I'm a pathologist pa, very easy, mas pipiyungan pa. So, this one, you try to compare under the microscope skin and trachea. Okay, it looks almost the same. Then, this is an esophagus. Diba? What's the lining of the esophagus? Squamous, non-keratinized. Very good. Skin is stratified squamous, keratinized. Very good. This one, a trachea and a stomach. What is the lining epithelium of the stomach? Simple columnar. Okay. Sometimes also with the urinary bladder. So what's the lining of the urinary bladder? Transitional. Okay. What is the synonym for transitional? Neuroepithelium. Okay, very good that we have mentioned this one. Alveoli. What's the lining epithelium of alveoli? Simple squamous. The mesothelium of the pleural cavity. What is the lining epithelium? Simple squamous, but the term is mesothelium. Cardiovascular. What are the organs in cardiovascular? Heart, blood vessels next to the heart, the bigger one. Aorta, arteries, wait, hindi pa sa capillaries, wait. Capillaries, veins, next sa veins, inferior vena cava and superior vena cava. Those that belong, even the lymphatics, they are lined by simple squamous, but the term is what? Endothelium. Again. Simple squamous, nice simple squamous, the term is really simple squamous. If it belongs to the cavity, body cavity, what are the body cavities? Pleural, peritoneal, and pericardial. If I'm going to give you that specimen, what is the lining epithelium? What's the answer? Choices, simple squamous, endothelium, mesothelium. Mesothelium. Very good. If I'll give you, mangita tag vessel dre, then I will put, what is the lining epithelium? Simple squamous, mesothelium, endothelium. Endothelium is the answer. Okay? This one. Vessel man ginagay, na red cells. Okay. At the pointer, what is the lining epithelium? Endothelium, red cell. Here, step 1. What's step 1? Epithelium. What's the lining epithelium? Uy, naboy goblet cells? Not sure. Hey, goblet cells? May goblet cells, no? You agree?
Ano, puti-puti daw.
These are the goblet cells. Oh. So if has goblet cells, unsa man na siya? Is it ciliated? It's still ciliated? Yes, ciliated. Next step. Cartilage. C-shape ba si cartilage? No. So what are the possible organs here?
Either
Bronchi or larger bronchiole. Ah, very good. Very good. Sige. If it turns out no more goblet cells, meaning this is already cuboidal. Meaning this is already cuboidal. Simple cuboidal. What is the possible? Uy? No, may cartilage. Okay, step 1 pa man tayo. Step 1. Sige. Step 1, possible. Very good to answer. Ha? Smaller, terminal, and very good. Sorry. Step 2. There's already the cartilage. Meaning, goodbye na yun si terminal and respiratory. Okay. From the terminal alone, you have to terminate cartilage and goblet cells. Very good. Okay. Identify na sa ta. The pulmonary artery ni gibutan no. Okay. Pulmonary artery daw na. If I will put the pointer, kanang green pointer, what is the lining epithelium? Endothelium. Very good. Okay. Kani, at the pointer, what is the lining epithelium? Symphus famous. It's already alveolar. Okay. Step 1. Asa man ta? Okay, kani, step 1. Unsam ni? What's the lining epithelium? Still with goblets? Still with goblets. Then, positive for cartilage. And this is, it could be bronchi, bronchos. It could be bronchi, bronchos, larger up to larger. Okay? O kani, iingon na niya bronchiole. There's no goblet, right? Next step is look for cartilage. Kapay cartilage, wala na. This one, cartilage ba nang gapunin? Dili na. Vessel. So what is this? Boy, what you have to look for the respite? Are there alveoli? Wala. Are there goblets? Wala. So meaning this is terminal. Oh, very bright. I'm very proud. Okay. Next. Ay, animal. Ibutang nga ng terminal daan. This one. Let's identify. First step. What's the lining epithelium? Simple cuboidal. You know man. Automatic yung simple cuboidal if you can no longer see goblet cells. It's very obvious also, di ba? The certification for the pseudo certified or respiratory ba? Di ba? So this is really the simple cuboidal. Okay, next step. Look for cartilage. Are there cartilage? No. So what is that organ? Terminal. Very good. This one. Yeah. No. By the time na we'll go to GI, si Google, maingon juga, you can really see Google is very bad. There are so many mislabeling ba. So, I will put the mislabeled. You have to identify, oh, doc, that's wrong. Then, that's what happened to last year nga. Oh, you're very intelligent nga. Because of your theory, you applied, you're very studying your lecture. Of course, you studied first with your theory. What you've learned from the theory, we will apply here. What we learn here, we will apply to Janpa. So for sure, 100%, you'll become second year. I tell you. Sige. So, first step, lining epithelium. What's the lining epithelium? Simple cuboidal. Next up,
Cartilage.
cartilage. Are there cartilage? None. So no cartilage, no goblets. That's terminal. We move further. Okay. This one. There's already simple squamous. There's respiratory already. Diba? Okay. To differentiate is to look for the alveoli. If there's alveoli and still with thick or simple cuboidal, meaning simple cuboidal, there's alveoli, simple cuboidal, there's alveoli. That's already the respiratory bronchiole. But of course, if purely alveoli, that's alveoli already. Okay, the suck, the duct, suck, the alveolus. Okay, simple na no? But very bad, sorry, we don't have the PowerPoint. Silang, I will really try to meet you next meeting. Okay, I don't like to fail you. But don't worry. You only need 10 points to pass. We'll do it the same. Okay? So, ato rin ng mga dirty secrets. No, I cannot let you fail just for this to pass. And during the board exam, only 6 questions. No? Only 6 questions. The rest is anatomy. No, okay, gusto pa na anatomy, they're combined man. Diba? So, very dumb. But histopath is very important. If you don't like histology, you really have to love histology. Why? GenPath from the beginning up to end, the same with histology. Then you cannot really relate with this with GenPath if you're very poor in histology and physiology. So, okay, goodbye.